Welcome to the show, Healthcare from the Hill. This show discusses medical-related issues and events. We interview the individual all the way from the patient to the professional. I'm your host, Dr. Amit Lahav. We have a very interesting show for you today. First, we will talk about hand arthritis problems as well as treatment, and we will also touch fairly significantly about a pioneer type of procedure for the base of the thumb, which provides you back functionality and ability to do all the things you were able to do before. We will interview Dr. Ted Weissman, orthopedic surgeon from Milford, Connecticut. Then we will address something that really affects all of us, internally as well as externally, in every aspect of our life, and that is stress. How do we cope with it? How do we manage it? How do we deal with it? And how do we come up on top? We will interview Miss Diane Frankel-Gramelis from Milford Hospital, who will teach us what to do in order for us to beat stress and enjoy life. Stay tuned. We'll be right back. Welcome back to Healthcare from the Hill. Today with us we have Dr. Ted Weissman from Orthopedic Health, LLC at Milford, Connecticut, associated with Milford Hospital. He will talk to us about a pioneer type of procedure which is not widely used around the United States, and only a few surgeons can do this, to provide you functionality and the ability really to return to every activity. For what? For arthritis at the base of the thumb. What makes us different from our ancestors long ago? Opposable thumbs, the ability to actually move this thumb in essentially 360 degrees would provide us better ability and function than what our ancestors and apes were able to do before us. That makes a difference of what we're capable of doing. But once you have arthritis in the hand, all fingers, including the thumb, it limits of what you can do. It also provides you pain. And when you have pain, you're able to do less. If you're able to do less, then obviously you're less able to enjoy life. You have pain, it is difficult, but there are things that can be done. Everything from the non-operative treatment, from medications to different type of exercises, to diet changes, all the way to the surgical procedures. And the surgical procedures can differ. It's important to know what your ability is regarding what you already have and who you're dealing with regarding surgery, what is the optimal procedure for you. Dr. Ted Weissman, thank you very much for being with us here today.
Good morning. Thanks for having me, Dr. Lahav. Appreciate it. As Dr. Lahav said, there's different treatments for arthritis, not just of the thumb, but anywhere in the hand. And I think it's important, before we talk about the new techniques and strategies for treating arthritis at the base of the thumb, which is very common, I want to just review with you and the audience a few things about arthritis of the hand in other parts of the hand that affect people. And one of the earliest signs of arthritis in the hand, and in fact the x-rays I'll show you in a few moments shows that it's early arthritis, is the first thing someone may notice on any finger, and it's the finger, it's the joint near the fingernail, and in the case I'm about to show you it's at the thumb, but again it could happen on any finger. There's a little, looks like a little water balloon I call it, or it's actually called a mucus cyst, and it's just body fluid that comes from the irritated early arthritic joint. And if I may, I have a picture of a patient who has a mucus cyst of the thumb, and what you can see in this picture is that if you can see that bump on the thumb. If you move about half an inch or so away from the base of the nail, you see a red mark. It's a little bit red, it's a little discolored, and it's a cyst. And they can be very painful, and they can be annoying, and they can be unsightly. And interestingly, though, the x-ray looks pretty good as far as arthritis goes. So I can also show you the next picture, which is an x-ray of the same person. So I saw them in the office, and then I said, let's get an x-ray. And what you can see is there is some, I think we went ahead a little bit. If we could just go back to that thumb picture that you had up first, that one. There's an arrow that shows a little gray area. You see the tip of the arrow, and that's the bump. That's where the cyst is, and they don't usually show up except as a gray area. Interestingly, the joint itself is a little narrow. The joint between those two bones, there's a little black area that remains, but there's still early arthritis. And again, from the early arthritis, fluid percolates up from the joint and makes a cyst.
So really the cyst is a reaction to the arthritis that you have in that joint.
That's correct. It's a reaction to the arthritis, and it's benign. People concerned, is this a growth? Is this a tumor? And I explain it's their own body fluid. It could actually get a little smaller and then get a little bigger. And it really is removed when people find that because of that bump, they are hitting into things and it's annoying them. They really don't like the look of the bump. Sometimes it actually can pop and drain on its own, and that could lead to an infection. So many times people opt for having it removed. And you may say, well, can you just stick a needle and drain it? The answer is you can. The problem is it'll come back if it's not removed, and it has to be removed where it starts, and where it starts is in the joint. So that's what a mucocist is, and when you go to see someone like myself, I can explain that in more detail, and we could make decisions about what to do for it.
So it's really, again, it's a reaction to the arthritis that's beginning within the joint, but really the ultimate treatment is to treat the underlying reason why the cyst is there, which is really arthritis in the joint. However,
yes.
if the arthritis is still fairly mild, then the treatment can be removal of the cyst to provide you, again, better functionality, less pain, and then also less risk for infection, even if it ruptures on its own, especially in, let's say, the more elderly individual, the very friable type of skin. That's
correct. And you don't, because this can rupture and heal, and eventually you can develop an infection. And the way I explain it to patients, you can drain it, it can rupture, but it will come back much like if you were gardening and you had a weed, and you cut the weed, but you didn't get the weed at the root. We all know that even though it looks fine in the beginning, within days or a week or two, the weed will regrow. So if it's not removed from the joint, then it's going to come back. And it's not a life-threatening problem, obviously, or even threatening the digit, losing the digit, but it is a problem and it is annoying. And in that same vein, there's another problem with arthritis that's further down the line, and that will be the next picture I show you. If I can show the picture of the index finger, which you had up briefly for a moment before, I can show you that there's, that's the one. What you can notice is the shorter finger is the index finger, and the longer finger is obviously the adjacent middle finger. And the very bottom right-hand corner, just to orient you, is you see a little bit of the thumb. So that's the index finger, and what you can see is that the finger looks a little crooked, the index finger, and there is almost no black space, no cartilage between those, right up there between those two bones where the arrow is pointing. And that is a more severe form of arthritis, and people end up getting little bumps on their knuckles, and they're called Heberden's nodes or Heberden's bumps. But those aren't usually removed because they cause some stiffness but not pain, and there's nothing that drains. And their motion is so good that if I can show you the next picture, I can show you that this is that person with the x-ray you just saw with that arthritis and the crooked finger, but he has full extension and full flexion. This is the index finger, with all the fingers making a full fist, and he really has minimal pain. He does everything. He plays golf, and it doesn't hurt. So what do you do for this? Observe. Essentially, you do nothing, because in most cases, this is not a problem that has to be dealt with surgically.
Well, if the function is there and there is really no pain, besides just a cosmetic type of appearance, the patient or the individual themselves still have excellent function, can do everything they want to do. So we say if it ain't broken, don't fix it. If it doesn't bother you, don't worry about it, we'll just watch it.
Exactly. That's a great motto, and that's a good motto to go by that we follow. Which brings me to the next part of the talk about arthritis, where sometimes something does have to be done for the problem, and that is at the base of the thumb. We call it the basal joint. And when anyone pinches the index to the thumb to the index finger, whatever pressure there is per square inch, pounds per square inch, it's multiplied by 12 times. So someone really who pinches at 6 pounds per square inch is about 70 pounds there. So you can see why at the base of the thumb, that person is having a lot of pain and eventually can get wearing and arthritis. And I'll talk about the treatments for it in a moment, but I'll show you a patient who has a normal. If we could put up the next, oh, you already have the next x-ray up. And what we're looking at there is the base of the thumb, and then all those little sort of square and round bones are the wrist bones called the carpal bones. And where they meet the base of the thumb, and the thumb is sort of flaring out to the side there, you can see how right there is a black space right in there, and that is a normal thumb joint. When someone has osteoarthritis and pain of that joint, the next x-ray, I think if you look at this one, have a quick memory of this one, you'll see what I mean when you see the next x-ray, which shows there is no black space between those bones. It almost looks like there's fluffy white clouds around it. That's not clouds, that's bone spurs. We call osteophytes. And that's a sign that the bone is irritating the other bone. There's very little movement because they're rubbing against each other. And those wear particles is what makes bone spurs. So they're not foreign particles, they're bone particles, and that's what you see. There's no black space. Which means there's no cartilage, there's a lot of bone spurs, and this person often has a lot of pain when they try, as you mentioned, rotate the thumb in the 360 degree. They can't even do that. Pinching hurts them as well, and it's stiff. So that beauty of the opposable thumb is now not lost, but it's certainly weakened. In some patients, it's lost altogether.
Well, the X-rays actually do show a big difference between what normal and abnormal is. But also kind of moving back a little bit, arthritis also can be really from different etiologies.
Correct.
There's osteoarthritis, there's inflammatory arthritis, such as rheumatoid, and there's also traumatic arthritis. But in any way, all of them kind of leads down to degeneration of that joint.
Correct.
So there's no really restriction how you get there, but once you're there, you can still have similar treatment, correct?
That is true. And at least in the beginning, the similar treatment is an occasional injection of cortisone to that joint, which gives relief. It's cortisone plus Novocaine, or lidocaine as we say, that actually takes the pain away. Obviously, it doesn't take the arthritis away. We can have patients take the non-steroidal anti-inflammatory drugs, the NSAIDs or NSAIDs, like Motrin, ibuprofen, Advil, Naprosyn, Aleve, all those. I'm sure I'm leaving many out, but people get the idea that's what they can take for it. Of course, they have to worry about other side effects like stomach upset, but it does help those inflammatory processes, as does the injection. I'm a believer in also the glucosamine, which is a supplement. It's a protein of cartilage that people find helps them. It doesn't have much or any in the way of side effects. And fish oil can actually help that as well. If that doesn't work, people can wear a splint. And a splint kind of keeps the joint from moving, so it doesn't hurt. But of course, if you're not moving the joint, you lose your function. And one other point you made about the arthritis, the traumatic and we'll call it the age-related old age arthritis,